Hello and welcome to Wellness Watch, a special show curated to ensure a healthy you and to acquaint you with the wide array of possible treatments and medical procedures India offers for various ailments. On behalf of DD India, we wish you all a very happy Republic Day. Let's embark on this medical journey. Wellness Watch with me each week. I'm your host, Preeti. Leprosy, also known as Hansen disease, is a chronic infectious disease caused mainly by a type of bacteria called Mycobacterium leprae. The disease affects the skin, the peripheral nerves, the mucosa of the upper respiratory tract and the eyes. Apart from the physical deformity, persons affected by leprosy also face stigmatization and discrimination. However, leprosy is curable and treatment in the early stages can prevent disability. Leprosy, one of the world's oldest diseases, continues to pose challenges in some regions, often accompanied by stigma and misinformation. World Leprosy Day, observed on the last Sunday of January, highlights the need for global efforts to raise awareness and eliminate this curable disease. This year's theme is Unite, Act, Eliminate, and it emphasizes on the collaboration to tackle the disease and its associated discrimination. In India, the day is observed on January 30th also to honor Mahatma Gandhi's dedication to those affected by leprosy. Let's take a closer look at the disease, its impact and the strides being made to eliminate it.
For millennia, leprosy was a dreaded disease, a diagnosis that brought isolation, fear, and a lifetime of suffering. But today, it is a curable condition, though the stigma persists. Leprosy, also known as Hansen's disease, is caused by Mycobacterium leprae, a bacterium that spreads through droplets from the nose or mouth during close and prolonged contact with untreated patients. Despite being treatable, it remains a neglected tropical disease, with over 200,000 new cases reported annually worldwide, particularly in Southeast Asia, Africa, and parts of America. The disease primarily affects the skin, peripheral nerves, eyes, and mucous membranes of the upper respiratory tract. Initial symptoms are often subtle: numbness, pale skin patches, and lesions. But untreated cases can lead to deformities, disabilities, and social ostracism. In extreme cases, nerve damage can cause muscle weakness and blindness. Leprosy isn't highly infectious, but untreated cases pose a risk, especially in overcrowded or under-resourced communities. Early diagnosis and treatment are crucial to preventing long-term complications. Treatment involves multi-drug therapy (MDT), provided free by the World Health Organization since 1995, kills the bacteria, stops the disease progression, and even prevents relapse. For patients with fewer bacteria, bacillary leprosy, treatment lasts 6 months, while those with more severe cases, multibacillary leprosy, needs 12 months of therapy. In India, the National Leprosy Eradication Program has made significant progress. The country achieved elimination of leprosy as a public health problem in 2005, with less than 1 case per 10,000 population. However, localized hotspots and stigma remain barrier. This year's themes of World Leprosy Day, Unite, Act, Eliminate, underscores the need for global cooperation to end leprosy transmission by 2030, in line with Sustainable Development Goal 3.3. In India, the goal is even more ambitious: zero transmission by 2027.
Leprosy is no longer a death sentence. With early treatment, awareness, and an end to stigma, the vision of leprosy-free world is within reach. Harshita Oberoi reporting for Wellness Watch, DD India.
Leprosy is a neglected tropical disease, that is NTD, which still occurs in more than 120 countries with around 200,000 new cases reported every year. Leprosy is reported from all the 6 WHO regions, the majority of annual new case detections are from Southeast Asia region. The disease affects the skin, the peripheral nerves, the mucosa of the upper respiratory tract and the eyes. Apart from the physical deformity, persons affected by leprosy also face stigmatization and discrimination. However, as we told you, leprosy is curable and treatment in the early stages can prevent disability. Today in Wellness Watch, we ask the following questions. What is leprosy? What are the types and stages of leprosy? How is leprosy diagnosed? How does leprosy affect the entire body? And what medical treatments are available in India with regards to leprosy? And the basic idea of the show is to showcase India as a medical hub. And up on your screens, we have the institutes and hospitals which specifically deal with leprosy cases. All India Institute of Medical Sciences, AIIMS, New Delhi, Regional Leprosy Training and Research Institute, Chhattisgarh, Lady Hardinge Medical College, Delhi, and Central Leprosy Teaching and Research Institute, Tamil Nadu. So up on your screens, we have the institutes and hospitals which treat leprosy-specific cases in India. All right, to throw more light on leprosy and to help us understand it better, we're joined in by a guest in the studio. We're joined in by Dr. Rajeev Joy Nathan, Medical Superintendent, the Leprosy Mission Hospital, Delhi. Thank you so much, sir, for joining us this afternoon on Wellness Watch. To help our viewers understand leprosy better, get us more as to what is leprosy, what defines leprosy.
Leprosy is a bacterial illness. As all other bacterial illness, it is infectious. It is spread through air, as was told, through the mucous membranes, and it, in layman terms, it causes the damage to the peripheral nerves and the structures in the skin. So, when you have the bacteria entering the body and the body immune system acts on it, we have reaction in the body which prevents the bacteria to spread. But because sometimes the bacteria is more powerful than the immune system, we have certain signs and symptoms of leprosy. Namely, we have patches on the body which are less in color and they are numb. That means there is no sensation, and that is one of the main causes of the person to feel affected by leprosy. The second thing is the bacteria enters the nerves, peripheral nerves, and as you know, peripheral nerves supply the hands, feet and the eyes, and that causes weakness and sensory loss and the loss of sweating.
Okay.
So, when there is a loss of weakness, then you have deformities and you have further damage due to the deformed status of the limb.
Okay. How is leprosy diagnosed? Because the symptoms which you tell us, when is it that a person would, how would the person take the legends seriously, or how is it diagnosed?
Leprosy is, if you are very cautious, then leprosy is very easy to diagnose. You have a patch on the body. Patch means any area of the skin where you find that the color is different from the normal color of the body, and then when you try to feel there, the sensation is less or there is no sensation. Normally you can feel heat and cold or prick sensation, all those will be absent in that area. So, once you have that, then you can ask the person to go to a hospital or a clinic to get diagnosed for further and checkup and for diagnosis of leprosy. That is one. The other is, if you have weaknesses of hands and feet, if you have slight weakness, then you should always go for a checkup and ask the doctor to examine and diagnose leprosy. And the third way to diagnose is, if the doctor feels that you need a test, then there is a simple test called the skin smear test, which is done in major hospitals and in some NGO hospitals, where a small amount of skin scraping is taken and the bacteria is isolated. This is known as a WHO cardinal science, because when WHO wanted to have a diagnosis for leprosy worldwide, they wanted to have something which was easier to diagnose, easy way of people being able to reach out and diagnose as many cases as possible. So, these are cardinal signs. Cardinal meaning that if even one of them is present, then you can safely say that this patient is suffering from leprosy. So, the cardinal signs are: 1, hypopigmented patches with loss of sensation; number 2, enlarged peripheral nerves with loss of function, function being either motor, sensory or autonomic. Motor means weakness, sensory means there is a numb patch, and autonomic means there is loss of sweating. And the third thing, that is how we diagnose, is the skin smear, which is done in the laboratory. Any one of them is present, then you can safely say that this patient has leprosy.
All right, sir, the very first symptom is a lesion, is what you tell us, but then it is mandatory for the lesion to not have any sensation. But then do these rash-like lesions, do they appear in any particular part of the body or the part of the body which is more exposed? How do we understand it?
It can occur at any place. It can occur on the face, it can occur on the upper limb, it can occur on the body, back, in the lower limbs, it can occur anywhere.
And is there any particular age group that is more prone to such symptoms, to leprosy?
No, no. Earlier we were saying that they were, it does not happen in children because the incubation period for the disease is long, but we get around 5% cases of the total population that has leprosy is child cases.
All right, we have been telling our viewers that leprosy is curable.
Yes.
To what extent is it curable? Because deformity, till what time in a span of a person's life does this deformity continue?
If you detect leprosy and if you start treatment early, then the chances of deformity and further damage to the body is less. So, early detection and early diagnosis and early initiation of treatment is the key element that helps in treatment. If you start treatment, then once you give the first dose of medicines, the MDT that we are talking about is that rifampicin, dapsone and clofazimine. So, first dose of rifampicin causes 99% of the bacteria to die. So, it is very important that the treatment is initiated and the treatment is completed.
Okay. All right, for our viewers who have just joined in today in Wellness Watch, we are discussing leprosy and we have with us our guest. We are joined in by Dr. Rajeev Joy Nathan. He is Medical Superintendent, the Leprosy Mission Hospital, Delhi, and he is helping us understand leprosy better. Sir, if I would want you to know, if I would want you to explain to us what is the current status of leprosy in India, because it has not been eradicated completely, but then we see a fall in the number of cases. Yes. What is the current status?
2023, if we take the status, the data that we have as of 31st March 2023, this year's data would be available on 31st March onwards. So, it is 1,03,819 cases, new cases were detected. That gives us a new case annual detection rate of around 0.76% per million. That is still a significant number if you think that from global perspective it is still around 59% of all new cases detected in the world.
All right. And when we talk of the detection of leprosy, till what time can a person not know that he's infected by leprosy? Till what time can a person, take over the counter medication for lesions, for skin rashes, and still?
See, if he understands that there is a patch which is numb and he initiates treatment, you can start it very
Anytime
early.
soon, okay.
But there are cases where people continue to be ignorant or unaware of the fact that they have leprosy till they reach a clinician, till they reach a doctor for any other illness sometimes.
Right.
So, it is not essential that everybody would have a deformity and then they would be diagnosed of leprosy. They can just have patches and they may not know.
All right. For our viewers who are with us today in Wellness Watch, we are discussing leprosy. We are talking of the status of leprosy in India, what causes, what are the symptoms, and we are joined in by Dr. Rajeev Joy Nathan, Medical Superintendent, the Leprosy Mission Hospital, Delhi, and we are also joined in by Dr. Vibhu Mendiratta, Director, Professor, Head, Dermatology, Lady Hardinge Medical College. Ma'am, for the benefit of our viewers, help us understand, can we call leprosy a skin disease? Because it starts with the skin, but how is a skin rash different from something that gradually progresses to leprosy?
Yes. So, leprosy is, we would say that mainly it is a skin disease, because the initial manifestations of the disease would first appear on the skin, and gradually it moves on to the nerves. So, when it appears on the skin, it is easy for the patient also to take notice of a patch on the skin, which generally, it appears as a light colored discoloration, hypopigmentation we call it, that the color of the skin changes from its normal brownish color towards a little whitish in nature. Then the patch then becomes dry. It may become a little scaly, and then there is loss of sensations also. So, if we just ask our patients to make this test, self assessment at home, by just putting a pin on the patch, and in case there is numbness, then it is suggestive of leprosy, which is the initial stage of leprosy, and it is very important for the patient at this stage to get in touch with a dermatologist, because they are the ones who are best trained for picking up disease early. So, that is the first manifestation. Then when the leprosy is in a reactional state, because leprosy can be simply asymptomatic without any pain, without any causing any symptom, it can also suddenly become aggravated. These are called the reactional states in leprosy, or the flares of the disease, which can happen related to the immune disturbances of the patient. So, many a times we see that the patients, they come to us in the acute stage with fever, with lot of red colored, painful, tender, nodular lesions, and there are raised lesions. So, these are bumps on the body, they can have arthritis, they can have eye involvement, they can have involvement of the testes, and even the kidneys also can get involved if they are not treated properly. So, skin is involved early in the course of the disease, followed by the nerves, and then you can have involvement of the liver, spleen, these are the organs, and then during the flare up of the disease, it can cause immune damage to the nerves, resulting in paralysis, loss of power of the hands, because the nerves are gone, nerves are damaged. Then it can also lead to blindness.
So, that can leprosy also lead to limbs falling off, body parts falling off?
Yeah. So, you are, I think, referring to amputation.
Yes.
So, what happens is that there is a particular type of leprosy which is known as the multibacillary disease, or to put it into common terminology, I would say that it is a type of disease which has got numerous bacilli in the body. So, the load of the bacteria is so much that these bacteria, they will destroy the peripheral nerves, the nerves of the hands, nerves of the feet, the peripheral parts of the body. So, gradually the leprosy moves from the nerves to the bones also, there is a loss of the bones also. So, you must have seen that in those patients unfortunately who have not sought early treatment, who have not been detected early, it leads to loss of digits also. You must have seen there is amputation of a finger or a toe. So, that is a very bad sequelae, it is a deformity which can be caused by leprosy.
All right, Dr. Nathan, yes.
I would like to add here, it's more of an amputation, it's more of bone resorption.
Okay.
What actually happens is because of chronic and recurrent bone infections, the bone becomes brittle and slowly gets absorbed. So, if you notice, some of them may not have complete long fingers, but they may have shortened hands, but you still have the nail there.
Okay.
So, it's not like diabetes or in Berger's disease where you have loss of blood flow, which causes gangrene and the digits to fall off. Here the digits are resorbed into inwards.
Okay.
So, you will have shorter hands. Even if you notice, they will have shorter hands, but these bones will be getting resorbed.
Yes. All right, so we were talking of the status of leprosy in India. There is also the aim, the target of making India leprosy free, leprosy mukt Bharat by 2027. Yes. Help us understand on the global page, where is India standing when we talk of medical treatments or medical advancements in India with regard to the national leprosy eradication program? What all is being done here in India?
We have a national roadmap 2023-2027.
Yes.
Which is basically tuned to get that figure, because WHO says that we will eradicate by 2030, but India, because we have 59% of the cases, we should be able to do more, and we should be able to have more advancements and more rigorous treatment modalities available. The government of India is doing a lot. If you see, they have in this roadmap, we have a regular LCDCs, that is leprosy case detection campaigns. We had ASHA led initiatives. We have SPERSH campaign. We have digitalization, so that the cases are registered and all the cases enter a system called NICUST, so that we can have a proper directory of patients and also have a contact tracing, so that each MB case, like multibacillary case, which has a lot of bacteria inside and they are shedding bacteria till they are started treatment. So, one MB case infects other people. So, if we can detect early, and all people who were in contact with the person, if we can go and detect whether they have developed any signs or symptoms of leprosy early, and we can treat them, we can reach that figure by 2027. All this happens, Government of India has divided India into different types of districts. We have 754 districts in India, out of which 488 are high priority districts. 42 have achieved elimination. There are 122 aspirational districts, where what we say is that we will do more work, so that the case detection rate is more. We do more case finding, we do surveys, we do contact tracing, we do survey, educate and treat set campaigns. So, these are things that we are going ahead with to achieve our targets.
All right. Would you also apprise us with the treatment which is given for leprosy?
Yes. Leprosy is, as we know, is an oldest disease, very old disease that known to mankind, and we WHO initiated the treatment in 1982, which was known as the multi-drug therapy, and that has been the mainstay of the treatment so far. I brought the packs that the WHO provides to all countries, including India.
Yes.
This is for the multibacillary, and this is for the paucibacillary. So, similar, this is for adults. We have similar packs for children also.
Okay.
So, these are provided free of cost, and they are doing very well. I mean, we have reached from 1984 to 2024 based on this. We have some cases who have antimicrobial resistance. For that, we do drug resistant testing, and if there are cases, then we start them on alternative.
All right. So, we've had a detailed discussion with regard to leprosy, but very quickly we'll have a rapid fire question round, some myth busters for our doctors to clear. Dr. Mendiratta, does leprosy cause body parts to fall off?
Not directly, but gradually, because there can be complications, bacterial infections, gangrene. So, then leprosy induced complications can ultimately cause.
Dr. Nathan, is poor hygiene the only cause of leprosy?
No.
Dr. Mendiratta, does leprosy only affect the skin?
No.
Should people with leprosy be isolated, Dr. Nathan?
No.
All right. Is leprosy a disease of the past, Dr. Mendiratta?
No.
And do only poor and old people get leprosy, Dr. Nathan?
No.
All right. So that was the discussion when we talk of leprosy this afternoon. Thank you so much, both of you, for joining us this afternoon on Wellness Watch. So, we had our doctors sharing more on leprosy and helping us understand it better, but we all need to unite around one goal, which is to beat leprosy. This World Leprosy Day, let's help spread the word that leprosy is curable. Join in to fight to end the stigma and advocate for the mental well-being of persons who have experienced leprosy and other neglected tropical diseases. Remember, awareness, prevention, treatment and cure will help in making a world free of leprosy. With that note, we'll end this edition of Wellness Watch. Till we meet next, take good care of yourselves. Bye-bye.